What is interventional radiologist? What exactly do you do, doctor?
So a lot of times when you hear about radiologists, you think of x-rays and other types of diagnostic images. But a lot with interventional radiology, what we do is we use this type of imaging to perform minimally invasive procedures. So the goal is to be able to use state-of-the-art imaging to try to minimize the degree of invasiveness and to perform procedures that would be with less risk and easier on the body.
And Olga, we do procedures throughout the body, but one of our focuses here in Miami is we do a lot of work in blood vessels, do a lot of advanced work in blood vessels. But again, we're doing minimally invasive surgery throughout the body.
All right, and for patients out there, peripheral arterial disease, or P.A.D., I read here, is caused by the same kind of disease, doctors, that causes heart attacks and strokes, but it's mostly in the legs. So talk to me about that and how and why that happens. Dr. Pena?
Yeah, well, a lot of times what we see is that you have some disease that narrows the arteries. The arteries bring the blood to the extremity, in this case the legs, one of the most common areas. And as there's disease that narrows these blood vessels or the arteries, you just can't get enough blood to the distal aspect of in this case, the foot or the calf or the lower extremity. And a lot of times that's really the essence of getting peripheral arterial disease. It's that narrowing of the arteries.
Dr. Powell?
Well, certainly, and as you touched on, it is the same disease process that causes stroke and heart disease. And in fact, this can be one of the first indicators that you have this systemic disease process. And one of the things that we need to focus on is those patients with P.A.D. are at risk of developing heart disease or stroke, and we need to treat patients aggressively to prevent those secondary diseases.